Hello and welcome to Expert Speak on Suicidal Treatment. I'm Jeremy Beachy. This is Psychology 496 with Dr. Harper. It's 14 September 2015. Most people have known somebody that's committed suicide or have heard of somebody that's committed suicide. Well, in the U.S., suicide is the second leading cause of death among 10 and 24-year-olds. In 2012, within the U.S., 5,187 people in the 10 to 24 age group committed suicide. The most common method of suicide was guns, suffocation to include hanging, and poisoning to include medication overdose. Over a 14-year period in the U.S., around 1,404 college students committed suicide. Nearly 90% of suicides are committed by those with some form of depressive disorder or other mental disorder. However, some people tend to commit suicide based on a recent traumatic event or some type of abnormal stress within their life. So we asked two experts what the best course of treatment was for somebody with suicidal tendencies. Our first expert was Dr. Lisa Betty. She is a PhD holder, licensed in clinical psychology, with a specialty in cognitive behavioral therapy. Our second expert was Dr. Terry Beers. He's a medical doctor with a specialty in psychiatry. Dr. Betty recommended a 3-phase cognitive behavioral therapy. In phase 1, deactivation, the patient discusses recent episodes of suicidal thought and behavior. In this phase, a foundation for treatment is built, and an understanding of how to deactivate suicidal thought is obtained from psychotherapy. In phase 2, modification, the patient is assisted in modifying skills that are closely associated with the risk of triggering suicidal behavior. And in phase 3, construction, the patient is taught relapse prevention techniques. So we asked Dr. Betty what her thought on medication for suicidal tendencies was, and she told us that there is evidence to suggest that antipsychotics and antidepressants can reduce the risk of suicidal tendencies, but the efficacy of these drugs on suicidal attempts has not been adequately tested. So she's not completely against drug therapy, but she believes the best course of action is cognitive behavioral therapy or a combination of the two. Dr. Terry Beers believes that the best course of action is drug therapy. And in this course of action, the first step is evaluating the patient, which is an essential element of suicidal assessment. During this process, information is gained about the patient's psychiatric and medical history, as well as current mental state. Step 2 is prescribing a medication and a dosage based on the patient's history and the severity of the suicidal tendencies. Step 3 is reevaluating the patient's mental state after a period of time on the medication. We asked Dr. Beers his thoughts on cognitive behavioral therapy, and Dr. Beers believes that cognitive behavioral therapy is helpful in treating those with suicidal tendencies, but again, believes that the best course of action is drug therapy. And the reason being is that it's much easier to take a pill than it is to commit yourself to go to see a psychiatrist or psychologist on a daily or weekly basis. But both of our experts agree that cognitive therapy can be helpful for those with suicidal tendencies. Both of our experts agree that drug therapy can be helpful for those with suicidal tendencies. Dr. Betty feels the most effective course of treatment in preventing future suicide attempts is cognitive behavioral therapy, and Dr. Beers feels that the most effective course of treatment in preventing future suicidal attempts is medication. Both of our experts agree that anyone with severe suicidal tendencies should be placed in a hospital for treatment before undergoing cognitive behavioral therapy or drug therapy.